Mr. President.
Senator from Louisiana.
Thank you, Mr. President. I rise today to discuss a serious crime and violation of human rights that must be stopped: human trafficking, a form of modern-day slavery, people profiting from the control and exploitation of others. And I rise as a doc, a fellow who's practiced in a public hospital system for 32 years, understanding the unique role nurses, physicians, and other healthcare providers play in this issue. Healthcare providers are frontline and one of the few to interact directly with trafficked women and children. A recent survey published in the Annals of Health Law report that 28% of trafficked women saw a healthcare professional while being held captive. Now, this doesn't mean that the nurse, doctor, or other healthcare provider had the training to recognize, but because of their unique and critical involvement with these victims, it is important that these healthcare providers do have the tested tools and training to identify and help those being trafficked. The Trafficking Awareness Training for Healthcare Amendment would save lives and, as importantly, would begin the rebuilding of lives destroyed by modern-day slavery. It would provide for the development of best practices to enable healthcare workers to recognize and assist victims of human trafficking. It has proven that many trafficking victims report receiving healthcare from federally funded clinics and emergency rooms while in captivity, yet, as mentioned earlier, go undetected. This legislation would improve the awareness of healthcare workers, ultimately helping these victims. Senator Tim Kaine recently spoke about a missive that Pope Francis gave on Ash Wednesday, calling for us to be islands of mercy in a sea of indifference. The ethic of nurses, physicians, and other healthcare workers is to be that merciful creature. This would give them the training to better enable them to be that island in what for that woman or child caught in captivity must seem a sea of indifference. Having passed the U.S. House by unanimous consent, this amendment represents a bipartisan effort that will enable the medical community to bring relief to those suffering in ways that those of us who have never been there cannot imagine. Senator Peters is joining me in this bipartisan effort. I urge my colleagues to support this amendment and help transform victims of trafficking into survivors, into people who blossom. I yield back.